My name is Karyn Poole. Ta-da! Here I am, in case I forget myself, and I've worked at YCCHS for about 3.5 years. I'm in the Family Health and Wellness Department under the very brave and tireless Cherry Veray. I used to give immunizations along with Betty Barnes, Julie Larson, Christine Dixon, and Leslie Jones, but about a year ago I replaced Joanne French as the Communicable Disease nurse. Down here on the bottom of this food chain, I was also the TB control nurse, briefly, until that role was assumed by the very hot Sally Slater. Thank you so much, Sally. Basically, I do the STD surveillance for all of Yavapai County, which means I collect data and monitor rates of chlamydia, which takes up about 60% of my time, gonorrhea, about 20% of my time, syphilis, about 10% of my time, genital herpes, maybe 7% of my time, and HIV, about 2% of my time. What do I do with all that data, inquiring minds want to know? I make charts, I look for trends and submit quarterly reports to the state where our numbers are compared with other counties and with national data to see where we may need to focus our efforts or where we might have trends that are inconsistent with other counties that have similar demographics. We also use that data to follow treatment trends and help identify gaps where providers may need more support or education. For example, here's some data I'm collecting about whether or not providers are treating gonorrhea according to CDC guidelines. Just stuff like that. You see Arizona's chlamydia rates are quite high, pretty much the same as all of the southern states, and of course California, Alaska, and Hawaii. We're a little better with gonorrhea than the southern states. And with syphilis, Arizona is really spotty. Spotty, get the pun? Spotty. We're kind of all over the board, but here in Yavapai County we're actually pretty good. You may be wondering where all that data comes from, or maybe not, but according to Arizona state law, all providers must submit a communicable disease report to the county public health office within 5 working days of suspecting or diagnosing a sexually transmitted infection. So I get several of these a week. Some providers utilize an online reporting system that I can collect reports from, and others just send their reports directly to the Arizona Department of Health Services, where someone there has to enter the info into this online database, and then they task it to me in Yavapai County. On occasion, I make field visits to interview individuals who've been newly diagnosed with syphilis or HIV, again to collect data and identify behavioral risks, as well as to identify care or support services either they or their partners need to get connected to. People who ignore my calls and certified letters might be a little surprised when I just show up. Some people are very guarded and suspicious and they don't want to talk. Sometimes they see a county car pulling into their driveway and they run and hide. But most people are usually receptive and pretty matter of fact. I might even get invited in to play a video game on company time. Just kidding, Stephen. 90% of the time, no one answers the door and all I can do is leave a note. That said, a huge aspect of my job is encouraging people to get tested and also to get treated. I like the Donald's approach. Get treated, get treated, get treated. Part of my job also includes acting as our county public health resources to our providers and to community providers who don't always have time to attend seminars and conferences, so I keep abreast of changes in CDC testing recommendations and protocols, syphilis staging criteria, and treatment guidelines. I suppose my biggest mantra is about being safe, using common sense, and protecting yourself and others from sexually transmitted infections. It's really so easy. So let's start with chlamydia, since it's the most common. How do you keep from getting and spreading chlamydia? Condoms. How do we prevent the spread of gonorrhea? Condoms. How do we prevent the spread of syphilis? Condoms. How do we prevent the spread of HIV? Wait for it. Wait for it. Condoms. Although we know some diseases can be spread other than the usual way, condoms are still the best strategy for minimizing risks related to sexual behavior. So that wraps up everything I managed to do in my 2.5-day work week, in addition to what else? Again, wait for it, wait for it. Yep, other duties as necessary. This public service announcement was brought to you by the Disease Prevention Department and is not meant to endorse or profit from any of the brands or products mentioned. Some people have had changes in behavior, hostility, agitation, depressed mood, suicidal thoughts, or actions while using condoms to prevent STDs. Some people had these symptoms when they began using condoms, and others developed them after several weeks of use or after taking them off. If you or your partner notice agitation, hostility, depression, or changes in behavior, thinking, or mood that are not typical for you, or you develop suicidal thoughts or actions, anxiety, panic, aggression, anger, mania, abnormal sensations, hallucinations, paranoia, or confusion, stop using condoms and call your healthcare provider right away. Also, tell your healthcare provider about any history of depression or other mental health problems before using condoms, as these symptoms may worsen while using condoms. Some people can have serious skin reactions while using condoms, some of which can be life-threatening. These can include rash, swelling, redness, and peeling of the skin. Some people can have allergic reactions to condoms, some of which can be life-threatening and include swelling of the face, mouth, and throat that can cause trouble breathing. If you have these symptoms or have a rash with peeling skin or blisters in your anogenital region or mouth, stop using condoms and get medical attention right away.